Kiti wa Tume ya kupambana na ufisadi nchini Eliud Wabukala anatoa taarifa kwa vyombo vya habari kuhusiana na ubora wa bidhaa za afya humu nchini. Moja kwa moja.
Yes. Because it's couched in that medical language which most of us cannot understand. And therefore we don't question. But sometimes we feel it's not proper. But anyway, I have to pay because I'm sick and I have no other option. I think transparency in this area is very important, and that's a governance issue. We need to be more transparent, have all the lists, like the report has recommended, available to all the consumers so that they can compare what they are taking and paying for and what they receive. Now, health policy, which provides strategic directions in the improvement of health care for Kenyans, therefore, is crucial. My friends, the report that we are presenting today is a result of a lot of work put into it, and I want to congratulate the team from EACC and also from the Ministry of Health that cooperated in ensuring this report is on our table. You notice the issues in efficiency in the procurement and in dispensing of the pharmaceutical supplies has been overemphasized in that report. It has highlighted some weaknesses, some loopholes, and some of the opportunities that contribute to unreasonable prices and major variances in the fees charged during the acquisition and dispensing of the drugs. I was particularly touched on the fact that if you pay cash, you might sort of negotiate and pay less. But you go to pay through an insurance cover, then the price goes up. So I don't know why it should be like that. I think the fact that we are all at the Ministry of Health, and I think government is focused on providing a universal health cover for everybody, we need to seal those loopholes. Because at the end of the day, even the insurance company's money is Kenyan money, which is earned through hard work. And therefore, we should not allow it to be filtered into those systems and become so expensive for medical care. At the end of the day, it will be an expense to the government and an obstacle to the delivery of other services. And so these recommendations will help us, all of us involved, to strengthen the systems in order to ensure the attainment of affordable healthcare provisions by the public facilities. It is our belief at EACC that the report will go a long way in mainstreaming service delivery and positively influence the healthcare system to provide quality medical services to all citizens by ensuring that avenues for corruption are sealed. And I want to add here, and I think it's a medical field where they say prevention is better than cure. All these systematic reviews that we make in many ministries are geared towards prevention of corruption. Prevention is important because curing is very painful. And as you notice, at this time in point in this country, we are on a very active process of curing what we have done wrong in terms of corrupt practices in the country. And this is very painful, but it is necessary because without curing these rotten places in our health system, in our management, then we shall collapse. And therefore, when doctors are trying to cure somebody, I know they love you, but if your tooth is paining, they have to remove it. And it is very painful. But the whole output is looking at the future, that after the painful experience, the good that comes out of it is bigger. In this case, when corruption is dealt with and prevented, we are looking at many jobs for our young people, cheap medical facilities, and even a healthier society. And so we want to focus on this that we prevent any loopholes that bring corruption in this country and stop it so that we don't create more cases of corrupt people. Perhaps I use this opportunity to say that this month of August, as we have witnessed and we continue to witness our surgical processes of dealing with corrupt people, I am praying that next year at the same time we should be celebrating that no new corrupt cases have evolved. It's our wish that we stop it, stop corruption, and that any other people planning to carry out corruption from this month should just stop. So that in a year's time, we meet here or somewhere else to say, yes, as a people, we have prevented corruption and we have stopped it. I am glad the Minister of Health has welcomed us to make this report as a way of trying to seal governance loopholes, so many discretionary opportunities that I saw in the system to be sealed, so that corrupt practices and expensive services are taken care of. My brothers and sisters, I want to thank you for coming to join us, and just to encourage all of us that in whatever capacity we are, let us put the service of Mwananchi at the heart of what we do, because God has given us an opportunity to serve Him in whatever capacity, and service is joy. Let's not use the opportunities that God has given us to exploit others, but to serve them, and together we shall feel very happy and create a wonderful society. Minister and all that have come, I want to thank you for coming and to encourage us to implement these recommendations as much as we are able to. I want to thank you, and may God bless you. Thank you.
Kind remarks. At this point, allow me to welcome the CEO to give the remarks and also undertake the presentation of the report. Bwana CEO, karibu.
Thank you very much. The Cabinet Secretary and the Chief Administrative Secretary of Ministry of Health, the Chair and the Commissioners of the Ethics and Anti-Corruption Commission, representatives and heads of various institutions here, including the representative of the Council of Governors, whom I'm informed is here with us, the management and staff from various Ministry of Health entities, the management and staff of the Ethics and Anti-Corruption Commission, the distinguished delegation from Malawi, ladies and gentlemen, good morning. We are here today to present a report which has been developed after an in-depth analysis of the systems, procedures, and practices in the procurement and dispensing stages of drugs and non-pharmaceutical supplies in the government health sector. Most sincere appreciation to all of you who in one way or another worked with the EACC team as it conducted the examination exercise. We all know that, of course, corruption is a major challenge facing many sectors or activities within our country. But we particularly know that the health sector in Kenya has also been, in the recent past, faced with numerous systemic challenges which stifle the full attainment of its objectives. The report we are presenting today is a tool that, if implemented fully, will improve services and ensure transparency and accountability in the health sector. Ladies and gentlemen, systemic weaknesses and loopholes in the acquisition and dispensing of pharmaceutical and non-pharmaceutical supplies provide opportunities for unreasonable market prices of goods and variances in fees charged at the dispensing stages. It is therefore in the interest of EACC and the Kenyan public to have a robust and efficient system that does not allow for pricing malpractices. And actually, if you look at or reflect on the figures that were displayed here, you'll really be shocked at the variance that you can see from some level or the source like KEMSA to what happens at the level of a hospital or any health facility. Nothing can be more shocking than seeing an item going for 700 shillings at the supply or the KEMSA level, but going down to the hospital, you see the same item being dispensed at a cost of 35,000 Kenya shillings. From 700 to 35,000? How much? How? Even if it's a profit, if it's a profit,